everyone, welcome back to Mental Health Chat. Today we're really lucky to be joined by Dawyte Clancy. Thanks so much for joining us today, Dawyte.
Yeah, thanks for letting me come.
So to get started, could you just let us know a little bit about yourself?
So I am a young person. I am sort of active in the youth mental health space. I do a lot of work in the community projects around mental health and I guess working with some of our vulnerable young people and children.
So working with vulnerable people, you probably come across mental health in your workplace and probably obviously it's in everyone's personal lives as well. Do you mind sharing with us a little bit about how mental health has been a part of your life?
I guess I have had problems with my mental health, and I have, from the very early stages of like the mild stuff, like anxiety and stuff like that, and then becoming unwell. Now I'm sort of on the other side of it, and I'm able to use my voice to help other young people know that their challenges are that they're able to overcome their challenges and they can really use their story to help others.
Yeah, and do you mind explaining a little bit about what were some signs and symptoms for you that your mental health might have been getting poor or you might have become mentally unwell?
Yeah, I tend to either shut off or become really irritable towards people, which I guess most people would say that is very out of character. But yeah, I guess I can become very impulsive in what I do. Yeah, just doing it without thinking.
Yeah, so I guess that sign that someone becoming unwell isn't just like people looking down and always withdrawing. Sometimes it looks really fun and impulsive, but it's also another sign that someone might be not coping. During your mental health, have you overcome any challenges or made it through any hurdles in your time?
I guess, with being a child that went through our child protection system, I guess there's that burden or trauma, some that I don't even know about. But yeah, I guess, and then I guess with the challenges of being in our care system and having those challenges and difficulties, when I was younger, I sort of had trouble with, I guess, emotional regulations and then going back to impulses. Yeah, I guess I have always had lots of challenges with my mental health, starting off mildly with like the normal anxiety and I guess mild depression, and then later on, I guess it all building up from not being able to talk about it at the time because, times have changed a lot since I guess those years, and I guess I went on to develop more severe mental health difficulties, which from different stages, I guess, looked like self-harm and it looked like self-harm and suicide attempts. And through that, I've been able to sort of get back to a healthier mindset, and now I'm able to, use my journey as a peer worker as at a mental health service, and being able to help young people on their journey and their families too, helping them understand what's going on for the young person.
Yeah, that's so great, and I guess that's exactly what I was going to ask you. Is what are some of the ways that you've or some of the things that have helped you get to the place where you are now? What are some sort of things that you do to cope or to make yourself more well? Or what are some strategies that you use?
Yeah, I guess throughout my journey, I've been able to pick up some key supports, some that I didn't have really at the start of um, my journey, and they've and then with having them in my life, I've been able to, I guess, come out the other side and.
Well, I guess I'd like to know is what did those key support look like? Were they like professional services? Were they good friendship groups? Were they peer support? What were those supports for you?
I guess I didn't really utilize, the normal therapy sort of route. I sort of went for what I found that helped me and supported me the most was, I guess that support through friendship and group-based work. I can also get help from my colleagues from work, and they're able to help me when I might not be doing so well and help me get back on track. And I guess that's a really key and strong support that I have at the moment.
Yeah, so it sounds like those social and positive connections around you are really important for your wellness. So I know that you do some work in advocacy and some youth mental health, as well as some peer support. So I do want to ask you, what does mental health mean to you?
I guess you sort of have to have like all 4 areas filled to be able to have good mental health. So you have to, be eating right. You have to have enough exercise, and then enough social connection with friends or work, but not to overdo it. And then it sort of has to level out, so it's all supporting each other.
So holistically, we need to look at not just how am I feeling today, but all those elements in our well-being.
Yeah.
And I'd like to know what things you do day to day for your well-being. Is there any strategies you use every day to try and have some, more positive or more healthy thoughts?
Yeah, I guess I'm sort of an auditory person, so I like listening to music, audio books and stuff like that. I guess, listening to a good TED Talk is also really good too, when you're just to give you the extra motivation.
So I guess mental health is always sort of on a spectrum of when we're all unwell at some times and we're all well at some times. Do you feel like from going through the struggles of being unwell that you've learned some things or some positives have come from it?
Yeah, I guess I've been able to learn more about understanding and empathy when it comes to, the people that I work with. I guess being able to come from a place of understanding and I guess to approach people with care, because you don't, it's sort of difficult. Like you can't sort of point out the person that's struggling because, like we've said before, like it all looks different to different people. And then, I guess with myself, I've been able to learn about boundaries and how far to push myself and how far, how much to let out. So it's all just giving me, I guess, a new lens to look through.
Yeah, I think that's a a really great point to make. And I also am aware that, you know, obviously your journey has helped you connect with others and be a leader as well in that health space. The people with mental health problems probably have gone through more uncertain times than most people, and right now is a pretty uncertain time for people. So what are some things that you do to manage uncertain or difficult times to help you cope?
Yeah, I guess trying to keep busy. I find when I'm not doing anything is when I'm more likely to slip into an unhealthy space. So I like to try and surround myself with people as much as I can. Obviously, lately it's been difficult to do that. But then in saying that, like we've all adapted to like the new way of Zoom and all of that, and we've been able to still stay connected with each other.
Yep, absolutely. And is there any advice you'd give to other people who might be struggling a little bit with feeling a bit more isolated, or just because there's just a bit more stress and worry in the world? Is there anything that you'd say to people to help them manage with the uncertainty?
Yeah, I guess from today we're allowed to go out a little bit more. So even if you can't visit people, maybe just go for a walk. And yeah, I guess now it's a really good time to start going for walks with the dry season now, and now that we're allowed out a little bit more, maybe try and organise with a friend to meet up with you, maybe grab a coffee, go for a walk, and then try and organise some Zoom chats, because I've been using it a lot, and there's some really cool features. Even though like we can't travel at the moment, you can set your background to like London or wherever. So I guess that way you can get out a bit more.
Yeah, make it a bit of fun as well. It doesn't have to be always, really serious when we're talking about mental health. I think half of our strategy should be things that are fun and that we enjoy.
Yeah.
Just to finish up the interview, Dawyte, I'd just like to give you the opportunity just to share anything else you'd want, or reiterate something that we've talked about, an important message just to finish up with. Yeah,
I guess now is a really important time that we all look out for each other, and I guess check on everyone, and offer help to people. I guess not everyone is going to feel comfortable asking for help, so maybe if you can just offer a hand with anything.
Yep, absolutely. Like we talked about earlier, you don't know what it's going to look like for someone, so we need to be checking in on each other, especially right now when it's so stressful.
Yeah.
So Dawyte, thank you so much for joining us today.
Yes, thank you.
Thanks everyone for watching, and thank you for improving wellness. Bye.